A condition in men called varicocele, or varicose veins of the testicles. And it's not something that a man would necessarily see on the outside, but something that an experienced doctor would diagnose in a clinic visit with the man standing and doing a careful visual and digital examination of the scrotum and testicle and sperm duct. Varicose veins, whether it's in your legs or your testicles, occur because of a faulty valve system in the veins in a given part of the body. The valve system is supposed to let blood go to the heart, but it's also supposed to keep blood from backing up. When the valve malfunctions and allows blood to back up, in this case toward the testicle, it causes overheating of the testicle, and pretty much anyone who's surfed the internet or read the Ladies' Home Journal knows that heat is supposed to be bad for sperm formation. So in this case, this condition comes on during puberty as the man is growing from adolescence into adulthood and as the testicle increases its blood supply and its size. And so what we will see is that if you take a group of men who develop varicocele and you follow a group mean over their adult years, in general, that group has declining fertility from puberty onward as compared to a group of men without this condition. What we see in the semen analysis, which is the gold standard of assessing a man's fertility, which is sperm count, sperm movement, or what we call motility, and the sperm morphology or shape score, which is a predictor of egg penetrating ability of the sperm. Any one of those, or all of them, can be affected. So the overheating from the varicocele is one thing, but the other item, which creates the individual difference from man A to man B to man C, is what that person's genetically determined robustness of fertility was. In other words, if you have a man with supernormal genetic fertility and you have varicoceles, it does not impact his fertility. Whereas if you have a man with average genetic fertility or slightly less, and then you add the overheating from the varicocele, that pushes that gentleman into a low fertility category. We can't go by a single sperm test, so generally we need at least 2 separated by 3 to 4 weeks in time to assess for a gentleman's variation over time. And when you have 2 semen exams that look relatively different, then we need a 3rd semen exam as a tiebreaker, if you will.